Good morning. My name is Romano Richard Capini, and today I'm going to talk about pneumonia. By the way, what is pneumonia? Pneumonia is the accumulation of secretion in the inflammatory cells in the alveolar space. Now, if I'm going to talk about the lung parenchyma, let's say it's the accumulation of secretion in the lung parenchyma. The lung parenchyma is around in the alveoli. This is the lung, as the diagram below shows that this is the lung. Here the air enters the trachea, it goes to the bronchioles and enters the alveolar sacs. Now there are different causes of pneumonia that bacteria, different causes of pneumonia will say forward, but today I'm going to talk mainly about the management of pneumonia. Okay, what are the classification of pneumonia? We can classify pneumonia into two: epidemiological classification and anatomical. Epidemiological, the vast majority of epidemiological classification. You can say hospital-acquired pneumonia, community-acquired pneumonia, which is mainly acquired in the community. Now, when we say hospital-acquired, we say nosocomial pneumonia, where the patient in the hospital can acquire pneumonia. Ventilator use. The use of ventilator can lead to ventilator pneumonia. Aspiration pneumonia due to aspiration of food and everything can lead to pneumonia. Now, when we speak about anatomical classification, mainly pneumonia can be classified due to anatomical. Mainly, it can be in the bronchioles. We call it bronchopneumonia. If it is in the lower, because the lung can be classified into different loads. So it can be lobar pneumonia, lower lobe pneumonia, hypoxic pneumonia, any pneumonia, any interstitial. It can be aligned with the interstitial space of the lungs. That when we say interstitial pneumonia. Now, etiology of pneumonia. Pneumonia, there are different causes of pneumonia, as I said before. There is bacterial cause, viral cause, chemical causes, and radiational cause. When we say bacterial cause, the most common is the Streptococcus pneumoniae, which is the main cause of pneumonia, and it causes a vast and a wide number of pneumonia. Now, protozoa and amoeba histolytica can cause pneumonia due to aspiration pneumonia. Primarily, respiratory interstitial virus can cause pneumonia and different kinds. Now, I'm going to talk about the clinical features and management of pneumonia, which the question it says. General symptoms of infection, that is malaise, fever, ligas. That's the general symptoms that the person may present with malaise, fever, body weakness. Okay, respiratory symptoms, main symptoms is coughing, dyspnea, difficulty in breathing. That's the main difficulty, and it is the main clinical signs of pneumonia. The patient will be coughing and will have difficulty in breathing. On auscultation, on examination, there will be diminished breath sound with addition of crackles. When you place the stethoscope at the lower lobes of the lungs, the person will be having a very low breath sound, and it will be accompanied with crackles. Now we are going to also the general sound of tachycardia. That cardiovascular rate will be high, respiratory rate will be high, and there will be accessory muscle use, and there will be mainly pain, which is mostly aggravated with cough. Whenever the patient cough, will have pain. Now, when we are going to investigation, there are different kinds of investigation for pneumonia. Let's say I go to the hospital, I'm coughing, producing sputum. What investigation I will do? I will do a first. First, I will do culture for the sputum, okay? Microscope investigation for the sputum to see if there is tuberculosis, there is any other things, okay? And confirmatory test, I will do radiological examination to see my lungs. If the air is filled, there is water to remove the pleural effusion, pneumothorax, and everything, because all of them they present with cough. Now those above there in the investigation of pneumonia. Now, what is the basic management of pneumonia? A different kind of management. There is pharmacological management and non-pharmacological management. When we say pharmacological management, a patient who has very severe pneumonia, first we have to admit that patient. And when we admit that patient, we should do ABC. Airway, and what is B? B, it's blood, and C, it's circulation. We check. If the patient is dehydrated, we do IV, the fluid resuscitation, normal saline and Linger's lactate. We provide that patient with the fluid. And if the patient is having dyspnea, difficulty in breathing, we put oxygen therapy, 5 liters per mil. We provide oxygen for the patient in order to keep the patient alive due to difficultness of breathing. And there is, now depending on the cause of pneumonia, there is bacterial pneumonia, different pneumonia. Now depending on the cause, we are going to treat pneumonia basically. Pneumonia caused by bacteria, we are going to offer antibacterial, and mainly the drug of choice is amoxicillin. That is amoxicillin and carbonic acid, 625 milligram, BID twice a day for 7 days. Now other drugs that can be used is ceftriaxone injection, that you can give 100 gram injection OD for 5 days, doxycycline 100 milligram. All of those are antibacterial that we can use. Also, in case of respiratory syncytial virus, we can provide different antiviral drugs, and in case if it is fungi causes, we can provide antifungal treatment for that cause. Depend on the cause of pneumonia, organism that cause pneumonia, then we have to treat depending on the cause. Now, what are the prevention of pneumonia? We can prevent pneumonia due to immunization, PPV. It's mainly common in children. It's provided at a lower age. If you immunization, it's not a long-term immunization, but it's what I try, PPV. Also influenza vaccine, since influenza also causes pneumonia. And stop smoking. Smoking, it causes vast or majority of respiratory diseases, and because it replenish the lung defense system, then it makes the lung prone to infection. Oh, thank you very much.